We begin this afternoon with the increasing COVID-19 case numbers, which are making Michigan the nation's hotspot for the virus. Nearly 9,000 cases were being reported per day over the past 2 days.
It is almost the highest daily case total we've recorded since the start of the pandemic. 7-day moving average now at 7,600 cases, which is the highest on record.
The latest rate of positivity is at 16.8%, with the 7-day average at around 17%, which is a 2% increase over the week prior.
All week, we've been telling you how hospitals are being overwhelmed by the recent surge in cases. Today, the state health department announced a face mask advisory.
Officials are recommending everyone over the age of 2 wear a face mask at indoor gatherings, regardless of vaccination status. That includes at Thanksgiving gatherings.
State and local health officials say this latest surge could last another 3 to 4 months. Spectrum Health is once again urging everyone to take the spread of the Delta variant seriously.
And the Delta variant really is a game changer with all of this.
Dr. Liam Sullivan, an infectious disease specialist with Spectrum Health, says that's the reason why state and local health officials are so concerned about this holiday season, and the reason for the face mask advisory from the state.
One person has the ability to infect 7 to 8 other people around them.
This current surge of the pandemic is expected to last at least 4 months. Right now, 72% of hospitalizations and 76% of deaths are patients who are unvaccinated.
And I think that adds a sense of urgency going into the holidays when people are going to be gathering even more and making the potential for the more infections to occur, more hospitalizations to occur, to strain the healthcare system even more, because we're not shutting down society like we did last year.
The only hope to end this pandemic is through vaccinations. Right now, the state is at 70%, but health officials say we'll need to be closer to 90 to 95% in order to create herd immunity.
But I think it's pretty clear that we need a high level of immunity to really slow down the spread of this virus, and we're not there yet.
The biggest thing to remember is that even though you may feel fine, you could have the Delta variant and continue to spread it.
The Delta variant is just waiting and lurking and going to go after people who are vulnerable.
So here are some ways you can stop the spread of the COVID this holiday season. Keep a window open for ventilation. Use air purifiers if you have them. Mask up and social distance when possible. And get vaccinated. It's not too late. Even if you get your vaccination this weekend, it will still give you some protection by Thanksgiving.
And we continue our coverage now on the pandemic's ongoing impact on our medical workers, including paramedics and EMTs. Today, we talked to the regional director for AMR, which serves communities around Grand Rapids and Holland. The pandemic has taken a huge toll on the ambulance service and the entire industry. And with some hospitals on diversion, not accepting ambulances, it can take even longer to transport a COVID-positive patient because every ambulance has to be disinfected between calls. AMR says the loss of workers has resulted in them getting creative to find new EMTs and paramedics.
We launched our Earn While You Learn program, where we hire. This is true job creation. We hire people that are interested in the healthcare field as full-time employees, pay them a salary while they sit in the classroom and learn to be a paramedic. 2, we recently implemented a $1.7 million pay increase in the market, where paramedics without overtime make as much as $78,000 a year. And 3 is we also pay the tuition for any EMT wanting to go to paramedic school and work for us.
AMR is applauding Governor Gretchen Whitmer's allocation of nearly $14 million in Medicaid reimbursement for EMS workers, which they say will be a huge help. Nationally, millions of Americans will be eligible to get their booster shots against COVID.
CDC's Independent Advisory Committee signed off on boosters for all adults earlier this afternoon. Now it is in the hands of the CDC director. Boosters were given the green light by the FDA this morning. At the moment, only older people, those with health issues, and those who work in high-risk fields are eligible. Speaking of that booster, Lieutenant Governor Garland Gilchrist received his booster shot of the Pfizer vaccine today in Detroit. His shot was given by Dr. Janae Caldoun, Michigan's former chief medical executive, who now works for CVS Health. The state says Michigan ranks 7th nationwide in the number of booster doses administered, with more than 1.1 million Michiganders having gotten it to date. Gilchrist said after losing several people in his life to the virus, he wants to make sure he is protecting both himself and the people around him.
Because even in the midst of cases increasing, people who are vaccinated are just much less likely to have a bad outcome. And the question that I think folks need to ask themselves is, if you are going to be exposed to COVID-19, or if you are going to contract COVID-19, would you rather be unprotected or protected?
Make sure you bring your vaccination card when you get your booster. You can also sign up to receive your flu shot at the very same time.
And the Kent County Health Department is hosting a free vaccine clinic for children ages 5 to 11 this Saturday. The clinic will be held at the Sheldon Complex on Franklin Street in Grand Rapids from 10 a.m. to 4 p.m. You can make an appointment online or by calling 211. A parent or guardian is required and must be present for the child to be vaccinated.